right, great. Sorry, I just wanted to see the red dot at the top and I see it. Um, so we are going to start off the presentation from the Community Services Board. First, we're going to hear from Raymond Payton, who is the program manager with the Wellness Health Promotion and Prevention. Sorry. Raymond?
You got it. You got it. Okay. So to make this easy, all right, I'm gonna go in reverse. My contact information is in the chat. So that way, if you need to contact me on any of the information you hear me speaking about this evening, you can just contact me directly. You don't have to go through a bunch of people. I know sometimes that becomes frustrating as you're trying to get educational information about services at the Community Services Board. And so I'm going to bring my slides up, and whoever I see, I'll ask the person I can still see if you can see my screen. Give me 1 second here. All right. All right. Who do I see? All right. You see it? Good? All right.
Yeah. Mm-hmm.
Uh-oh. Sorry. There we go. All right. So again, my name is Raymond Payton. I am the program manager for the Wellness, Health Promotion, and Prevention Program. And essentially what we do in my department is we are the public health arm of the Community Services Board. Meaning we do a lot of community classes on stuff you'll see me go over, like opioid overdose training, suicide prevention, um, ACEs, and I'll get into what all those acronyms mean, right? Because I want to make sure it's beneficial. We were just having this conversation before we started about sometimes you work in certain spaces and you use names and people are like, "What? I don't know what that is." So I'm going to utilize slides to kind of give visuals to give backing to each particular program. So by the time I'm done, you will be well versed in what we do in my particular program. All right. So to start off, you'll see this again. So these are some of the services offered that you'll hear about from some of the other departments that are represented in here tonight, which is like children, youth, and families, developmental disabilities, mental health, substance use disorder. I am at the end with prevention and wellness, and then assist the community in strengthening its emotional health and ability to handle challenges related to substance misuse and mental illness. Again, we are like the go-between, and for us, our contact in the community really matters, or it's important, because a lot of people in the county, the first time they come in contact with mental health services or substance misuse services will be through our agency at a community event. And how we present has an impact, right? It has impact on whether that person may want to continue to get services or ready to deal with the issue, or they may not be ready. So it matters when we first interact with people. So that's why we always want to make sure we are presenting our materials to the fullest extent and making sure there's clarity whenever we leave a room. Because when people feel there's clarity, um, it'll lead them to want to seek out the services. So these are some of the overall services. Again, I am at the end with prevention and wellness. So some of the programs, and I'm just going to go through some of the programs we do in my program, and you may find these beneficial to something that you want. And I'll tell you about how to obtain and receive these services as I go down. All right. So this is just our framework, right? So we cross the bridge of substance misuse, suicide prevention, and mental health promotion. Those are kind of the areas we cross in all of our training. So this is just our framework, and all our work is surrounded by one of these areas, right? We are invested in one of these areas in the community, and let me go into that. So one of the first things we do is building resilient communities and understand adverse childhood experiences. In short, without adverse child, what this is a class, and what this class does is it provides people to understand about trauma and how trauma impacts us as youth, right? So what it states is what we're basically trying to educate people on is if you experience trauma as a young person, right? You see all these young pretty faces here, right? These young beautiful people. How it impacts us as adults matters, right? The things we go through as youth, the trauma we face, and if it goes unresolved, it has a direct impact on how we function as adults. And we do this through a training of brain science and how things that impact the trauma impacts our brain. How does that then impact us in the community, right? How does that impact us in our ability to build resilient communities? Because there's resilient individuals and there's resilient communities. But if you have resilient individuals, then we're better at building resilient communities. So that's what we're educating the community on. If we put protective factors around young people, because young people need things, right? If we're able to put those protective factors around it, and protective factors, I mean having support, right? Having an adult they can trust, somebody they can talk to. Those having the access to that increases the chance of young people growing up healthy, happy, and resilient. So that this class kind of puts the framework, the scientific framework behind how does the trauma that we experience, how does that impact us later on in our adulthood, and how does that impact generations of family. So we do this class, and this class can be done, we do it in a variety of sessions. We do a basic overview class that's like 60 minutes. We do a more in-depth class that's about 90 minutes, and then we do the full-on class, which is about 2.5 hours. It's based on the community need and what they need, from us at that time. Some people just want an overview, so we do that. So it is something we engage with the community as they need it. But it's a very interesting class, and we want to make sure that people are understanding, the science behind how trauma impacts youth and how those youth are impacted as adults. So that's what our ACEs training is about. The next thing we do is mental health first aid. Mental health first aid is about an 8.5 hour class. We what this class is about is how do people in the community, right, provide support. How do they provide support to somebody who may be experiencing a mental health challenge, right? That can be, and we go all the way from early intervention to somebody who was in a crisis. How would you support that? How would you support that person? So this class, it's 2 hours. So how it is we do 2 hours of independent. So don't worry, it's not just 8.5 straight hours. It is 2 hours of independent work, right? That gets you in preparation for the 6.5 hour class, and we do that. And so there are two different ways you can take this. They're open enrollments, and let's say if you have at whatever your house of worship has 20 people, 20 to 25 people, we'll come out and do it there, right? We can do it on site, we can do it virtually, and that's how a lot of our trainings are offered. This is a very good class for people who just want to get some basic knowledge on how do I support maybe a friend, family member, loved one, somebody who is struggling with a mental health issue. How do I support that person as they're going through this issue, right? How do I, how can I show up for them as they need at that time? All right. So as you see, the next slide, it says question, persuade, and refer. This is our suicide prevention program in the county. A lot of times I will tell you, I talk in communities all across Fairfax County. There is a lot of stigma attached to suicide prevention. And a lot of times people do not, they'll come and say, I really want to, engage with my particular group, but I don't want to bring the idea of suicide into a certain space. I will tell you, like other things that happen ills in the community, whether you choose to talk about it or not, people are already thinking about it, right? Thinking about it without any kind of protection is way more harmful than having a class where people can express, hey, these are things that are going on with me. Because one thing I've seen from this particular class is it has the ability to change because you never know where a person is at during that training. We've had people need to step out of the training because they are personally experiencing something at that time. So whether you have the discussion or not, I always tell people, it's like, well, I don't really want to have discussions about drugs and stuff like that. Listen to me, especially when it comes to young people. Whether you want to talk about it or not, my job is to let you know it's happening, right? It's happening and they're talking about it, whether you're not comfortable. So that the thing is, how do you become comfortable? Because as I say in a lot of rooms, when I say we, I mean all of us, community, county in general, we all have to get comfortable with having uncomfortable conversations. Conversations allow us to change culture because there's dialogue. So when we have dialogue, there's opportunity for change. But if we continue to say, well, I'm just not comfortable, when is the change going to occur? That is the thing we have to look at. And it's no one person's responsibility. So we train individuals and groups. So at least you feel armed, because what happens if somebody approaches you and they want to have a discussion and you don't feel comfortable, or you don't know how to have that conversation, and you're the person they need to talk to in that moment? Just something to think about. So QPR, question, persuade, and refer, is our suicide prevention class that we facilitate in the county. The next one we'll talk about, you may have heard this before, is Revive, or opioid overdose and naloxone education. We do this training every week. We do this the same way. We do in-person trainings, we do virtual trainings, we do customized training. Meaning, again, if you have a group and you contact me, you have a group and you say, hey, Raymond, I have some people at my house of worship and I want to, make sure they get this training. If we come to your church, that Fairfax County residents, we will not only come to your house of worship, sorry, we won't just come out there. We'll bring naloxone, which is the life-saving substance that we use, for people who are experiencing an opioid overdose, right? So we'll come out. So I always like to tell people at no charge, because if um, my supervisor here. So if I told you I was charging you, I may have some problems after this meeting. So I always like to make sure people know it is free, right? You're a Fairfax County resident. You take the training, we provide for you on the spot. If you take it online, if you take the training online, we'll mail it to you, right? I don't know how much better service you can get than that. I think I sold that really well, right? Take the training, we'll come out to you and do the training. You come take it online, we'll send it to your house. What is better than that? You don't have to leave your house. And if you do leave your house, you're getting something either way, right? So that is our Revive training. We do quite a few of these. But the good thing is our number actually reduced in the last 6 months. And the reason being is that we do so many trainings, right? So many people have gone through the training that people are realizing the dangers, right, of fentanyl overdoses, right? It's a real thing. Again, whether people want to get involved in a certain way, it is something that's going to involve you either way. We are all impacted by this, all of us, not just in the county, but this is a national issue, right? With fentanyl use and access to fentanyl. I'll give you an example of something. When I started this a few years, it was every nine, it was either every 8 or 9 pills that you came in contact with was a fake pill, right? Today, today it's five. Five out of every 5 pills, one of those pills is a fake pill, right? So therein lies the issue. If you don't have that understanding, right? Because people think, oh, it's not going to be but so harmful. All it takes is one bad experience. One. So we want to arm as many people. The state wants us to arm as many people as possible, with the education, and as much as possible as we can get to the community in terms of making sure they have the naloxone in communities. So again, I'm gonna sell it to you one more time. You can sign up online, or mail it to you, or you can contact me directly and we can set up some classes that way. All right. So Lock and Talk is a state initiative that we have. And what this does is a suicide prevention initiative where we, as the CSB and all the across the state, provide the community with materials like gun safety locks. We have trigger locks, gun locks. We give medication lock boxes. I will give you a perfect example of why this is vital. A lot of times we go out and do community events, which you'll hear me talk about. At these community events, we pass out. We often come in contact with different families with small kids in the home, and I will tell you, I've been seniors, older parents, grandparents, and they will have 4 or 5 kids. We'll get into having a conversation. I'll ask, hey, I'm not to get in your business, but do you have any medication in your house? Yeah, lots of it. Lots. Where's it at right now? Sitting on the counter. Do those kids have access to it? Yeah. Yeah. And then we say, well, take a box, take two. Why? Right? Because my job is to help prevent something from happening. That's where I'm invested in. That's where we utilize. So this program, and the good thing about it is, if you contact me, I can give you a list. You can go to any CSB site in Fairfax County and get a medication lockbox. It doesn't necessarily have to be for you. It may be for your next door neighbor, right? I meet more young people than I can count. They'll come up to me at a community event. And you know kind of how people are, right? They come around the table, they're hovering. They're hovering around the table. I know they want something, but they don't know how to ask me. Why? Because the mother is there, right? The mom is there, and I say, hey, you need something? Can I get it? And they whisper, can I get one of the gun locks? Man, you got a gun? Yeah, take two, right? Because at least I'm not the police, right? We're not the police. So it's not my thing to say, hey, this kid told me he had a gun. That's not what we're doing. We want to make sure we're promoting some level of safety. The safety is what we're going for, right? The preventative measure is what we're going for. So that's what this is. How do we help the community provide methods to keep people safe, right? We can deal with that, but that's when you see to the next part of this presentation when we get into the treatment thing. And then it gets behind, well, why do you have a gun and how do we deal with that? But my first thing is, how do we keep you and the three other siblings in your home safe, right? How do we maintain that? And we're able to do that through having several and again, this is at no cost to the community, right? A medication lockbox in value is they purchase at $35. We giving them to the community for free because it matters. Because we want the goal is to keep people safe. How do we keep people safe? And so this is one of the ways we work to do that. And so this is what it looks like. We also have drug deactivation kits. I will tell you very quickly. I will give you the sales pitch for this very quickly. If you have older medication in your house, if you see to the left where you see where it says deter, that is a bag. You would tear that bag open, put some water, put the drug in there. Any old medication you have in your house, you pour it in there, you pour some water up, and you seal it back up. You shake it and you put it in the trash. It's not harmful to you. It's not harmful to the community. It's not harmful to anyone. It can go right to the trash, no harm. What we don't want people to do is flush old medication in the trash. Why? It goes into different spots. We don't want that, right? Because then it could be harmful. We don't want that at all. So that's why we want to keep stuff as clean as possible. With these, I always tell people, if you just want these, let's say you don't want the medication lockbox, but you have some older medication, you can always contact me and we'll make arrangements to get it to you. Why? Because it matters. Because it matters that we can prevent something from happening. Because if you have old medication and the wrong person gets a hold of it and then they get sick, let's not have that. Again, what did I say at work? I'm in prevention. Prevent. I don't want stuff to happen, right? We don't want that to happen. So that's just another thing that the community has access to that they don't always know about. All right, and so one thing we do here this is not a part of our program and that we help facilitate is the Fairfax Prevention Coalition. And what the coalition is it is a group of membership of other county agencies, but our main body membership are community members, people like yourselves, your congregations, people who come to your house of worship, right? To participate in how are we going to actively reduce substance misuse in the community, right? That's what the coalition does. How do we as individuals, because again, our primary goal is to help communities build resilient neighborhoods. Resilient meaning you take a hold of and be responsible for and have input and say in what actually happens. And this is a way to have voice, through that. And if you have interest in doing that, you can contact me. We have a coordinator for the program. I'll get you linked up. And we have meetings I believe they're the second Wednesday of every month at 6:30 in the evening. I changed the meeting time to the evening to make sure people can have access to going. But all voices matter. And this is an opportunity for people to have say in that. All right, so Problem Gambling is an initiative. I don't know if you saw one of the ads we have shown or ran in Fairfax County, but one of the main reasons why problem gambling prevention has become a hotbed topic in the state is because of the link of problem gambling and suicide, right? There's a thing. What happens? People get caught up in that cycle of, oh, I need to get some money. I'm desperate. Well, what's the fastest way you know? It's well, let me go. Let me try to take my money and do whatever. It doesn't have to be people who have a gambling habit. Problem gambling is, for an example, you have, you're short on your rent money. You say, well, if I go to the casino, I may be able to double it, right? That sounds illogical to people who are calm, right? If you don't have any problems, to you that doesn't sound like a feasible way out. But if you're a person who is desperate, right, that's when it becomes a problem. I am desperate to get these monies. I'm desperate to do whatever. And so you don't make it. So now I have failed my family. That's where you start linking up. And so substance misuse, suicide, and gamble all cross intersect, right? All cross intersect. So we do a lot of promotional material. We sit on a lot of promotional material, and we'll actually be doing classes in the upcoming year on gambling prevention. right? How, if you're going to do it, how to do it safely. All right, so SPAN is another community group. We have the Suicide Prevention Alliance of Northern Virginia, and what that is, it's a regional project with myself in Fairfax. So it's Fairfax, Alexandria, Arlington, Prince William, and I'm leaving in Loudoun County, right? And so we come together and work as a region. How can we work together to come up with ways to support people who work in the space of suicide prevention? So we support community groups, we do campaigns um, through the county, and we want to make sure that the people who are doing the work, we're able to provide support from them to them. Sorry. Talk They Hear You is another one of our classes where in all this, it's a class we do once or twice a month. The basis of this is how to have conversations with young people about substance misuse, drugs and alcohol. How do you have a conversation? How do you start that? Because some people come to me and say, I don't have no problems having a conversation with a kid. Yeah, what does that look like? Right? And they don't know. Some people do know. And it's also a good opportunity for people who do know to share with other people who struggle, right? In that particular class. What are some tips on how do you talk to your young people about drugs and alcohol? Because again, whether you think it's impacting you or not, your young person or young people around you, they're connected to somebody who it is a problem for. And it's only a matter of time before that moves over. Owls Pals is a youth program we have in the county. We do these at a lot of daycares throughout the county. And this is for ages usually between 3 and 6. And what it basically is about is how do we get kids started making healthy choices? How do we get them to make healthy choices? How do we have them engage with each other? So it's kind of one of those things. If we start young, right, and it's used to puppets. I see you see my artwork here, right? We have puppets, and it's a program where we use puppets to interact with other people, right? How do we show them at a young age to interact and you know keep that those relationships going, because the habits you develop when you're young, you're more prone to keep when you're older. All right. So Test Your Mood is just a site we have. So if somebody, they may not be feeling well, we refer people to the site just to say, just take an assessment to say, hey, I may need to talk to somebody else. And I'll put this at the end when everybody is done, just so you can refer back to it. But then I think they're also going to send the slides out. Counter Tools is our measure where we go and we send stuff out. We send literature to merchants about selling to underage youth. That's essentially what we do in that program. And lastly, community events. We travel all throughout the county, and if you're having an event or somebody you know is having an event in the county and you would like us to participate, you can contact me directly, and we will be more than happy to come out and support your event and anything you're doing. All right. We bring the materials that you see on the table. We have everything, to come out and make sure that we're accessible as possible. It doesn't matter. We do it year round. And that is the end of my presentation.
Thank you very much for that, Raymond. That was an excellent presentation. Now we will move to Brian Anderson, who is the Division Director for Assessment and Prevention Services.
All righty. Good evening, everybody. I'm going to actually start off pretty much in a sense where Raymond left off. I do have a PowerPoint presentation slide, but I kind of want to connect with this group through squares, so that information could be sent later. Raymond talked a lot about QPR, or at least if you caught that portion. That's question, persuade, refer, because I know letters throw us off. We look at QPR in the mental health world like CPR. So that's the easiest way, I believe, to have that acronym. But where I really want to focus on is, as faith-based leaders, what kind of suicide prevention strategies can we utilize, right? So some core concepts is briefly what I'm going to talk to everyone tonight about. So I think it first starts with attitudes. If folks on this call are teaching and preaching to folks within their house of worship, right? How do we make sure that we present ourselves to be available when someone comes to us and may have thoughts of suicide, right? How do folks experience you if they're experiencing a loss from someone who's committed suicide or died through suicide, I should say? Like, how do we make ourselves available? How do we make ourselves emotionally present to receive them? In addition to that, it's having an overall awareness. When I say awareness, it's making sure that folks know that we have influence, right? We have influence when someone walks up to us, engages us, talk with us, looks for guidance, right? Looks for encouragement, looks for support. How are we going to be available for them? right? So just having that overall awareness of the words that I say can either possibly move this person to receive help, or if we come at them in a different perspective and we're not at our best, that conversation may go a different route. So to me, it's attitudes and awareness of the first two things that faith-based spiritual leaders can have in terms of prevention suicide strategies. Theological reflection. Where are you at in terms of your own mortality, in terms of life, death, and how we see suffering? Right? Because the people who are going to come to us are going to come to us in this kind of space. So have we worked on our own selves, right? So we could be a model. So literally the issues that we're struggling with don't come on to the person needing our help, right? It's the old analogy that we got to make sure that we have our oxygen mask first if we're on that plane before we can help the next person. So are we at a place where we are able to assist because we're well enough to take care of the next person who needs our help? Um, the other thing I want to make sure we talk about is just rapport. How do we connect with people, right? How do we give ourselves to be readily available, emotionally available, open, right? Making sure just little stuff, right? Making eye contact, giving people a smile, getting to know people that come to their place of worship on a regular basis so they don't feel that you're out of touch, right? They feel that, okay, this person is really ready to receive me and that I'm naturally available to help. Reducing stigma. How do we promote the benefits of asking for help, right? If someone's having a difficult and hard time, do we make sure that we normalize those conversations? And if we haven't done it yet, can we do that? To say, if someone needs help, okay, I can educate folks in our place of worship within our faith-based community to get help. And this is how it takes place. Community building and prevention leadership. You just heard Raymond Payton just talk for the last 20 minutes. After we get off this call, are you going to reach out to him? Are you going to reach out to me, right? And come to some of these tabling events. So this isn't just like a one-off experience. So those are the things we talk about, community building and prevention leadership that we talk about. Okay, do you publicize this in terms of your announcements, rather be through like a newsletter through your place of worship, or when service is happening, you take 5 or 10 minutes just to give these kind of updates because it's fruitful and beneficial to folks that look for support. Role clarification, I kind of noted, you'll see on my PowerPoint slides at some point later, right? As faith-based leaders, we should continue to provide spiritual guidance while knowing the basics of suicide prevention. Hey, when you leave this, you're not a therapist, but can you have some one-on-one education and have a general understanding of, okay, how do I assist someone who's isolated, who's disconnected, right? If they're outside their normal selves, you know how to reach out and connect with them so they feel like, okay, this person actually is paying attention to me, and then they can actually feel that this person now is readily present for me to engage in a conversation. If I'm struggling, they're not going to push back or push me on to someone else. Because that's what a lot of folks that struggle with mental health symptoms, rather be depression or anxiety, focus. Well, let me connect you to this person. Well, I want to talk now, right? How are you prepared to have that conversation? In terms of culture, spiritual leaders should continue to take into account someone's culture and provide an avenue for individuals to share more about their cultural needs. Everyone that comes within your place of worship may not look like you, act like you, may not have been raised the way you've been raised, may have a own experience that is nothing like yours. How do we let folks teach us about their culture and we can receive them in that kind of format, right? So that's also important when we work with folks that may not have the same life experiences that we have. That also helps with that rapport building that I mentioned earlier previously, right? If you feel that someone is accepting what they're bringing forward to you and it may not feel as accustomed to what you're experiencing, they know that you actually genuinely care because you're taking the opportunity to listen and understand their experiences. And that goes right into active listening, making sure you provide a safe place to listen and understand the person before giving advice and initiating a safety plan. So you may have the best intended places to move someone to get help, but if you've not listened and heard them, you could route them, you could take them down the wrong rabbit hole, right? Because you haven't listened closely enough, right? If someone is saying certain things, right, about wanting to give away their possessions, right? Talking about, I just can't take life anymore, right? You may have a certain space where you may want to take them, but if you don't listen closely enough, you got to know how to engage them with how to get additional support, right? So for us in the Fairfax Falls Church Community Service Board, if we know that it's beyond our scope, even though I'm a therapist and some folks on this call are therapists too, but you're not, how do you get in touch with emergency services, right? How do you reach out to make sure someone gets immediate and imminent help, right? How do you listen intently to make sure when that person leaves your space that you can feel comfortable that you're literally transitioning to the next person who can provide help? How do you connect with other caregivers? Do you know other family members, someone that can also provide additional support if they're struggling, right? So this person doesn't feel isolated or disconnected when they leave you, right? All these things are critically important when working with individuals that are highly vulnerable and thoughts of suicide are going on for them at that present time. A few other slides, then I'll wrap up, and then I'll transition to my colleagues and pass it back over to Suzette. But guidance and consultation is big, right? So being available to mentor other faith-based leaders who may be newer in their role of leadership. How do you take on mentees, right? How do you work with other folks if you're the most experienced person within your place of worship to make sure that everything doesn't stay with you, right? That you're growing other emerging leaders within your faith-based community. So you're growing a village versus just growing yourself, right? So those different things faith-based leaders can do. Resource sharing, just knowing kind of what's out there. I've mentioned question, persuade, refer, QPR quite often, but have you signed up for what Raymond talked about with mental health first aid, right? He's offered a multitude of ways. He was doing a wonderful job explaining how this could be done virtually and in person based on the need of the group. So making sure you reach out. NAMI is the National Alliance on Mental Illness. Do you have enough content information to understand when you meet folks in the community? Because maybe the person involved that's struggling may not be them, but it may be a son, it may be a daughter that is struggling from mental illness. How do you work with those folks, right? 988 is now the national hotline for mental health emergencies, right? Those kind of things, those ways of educating folks that come to your place of worship are critically important. And lastly, just as I mentioned previously, collaboration with prevention programs. How often are we invited to these kind of spaces? Do you connect with us after these calls, right? And know just what we do at Fairfax County, because Raymond gave like 6 or 7 different levels of prevention programming, right? So just being further knowledgeable and understanding what we do collectively in terms of prevention services. I also, and I'll put a last low plug, then I will turn the mic over back to Suzette. But I also work as a division director of assessment services, which is really the pathway to how someone gets treatment within our agency, meaning someone walk in most often in their worst day, right? They are at a place now where they have surrendered and are looking for help. We make critical, important decisions to say, okay, this is what our community service board offers for youth, offers for adults. We work with individuals. Daniel Cornell will talk about this, individuals that have ID and DD diagnoses and different developmental disorders and delays, making sure they get handed over in a warm way and feel supported, right? Folks with substance use disorders get taken care of. Okay, folks with just mental health case management needs, maybe they need to get connected to a primary care physician or take different medication related to anxiety and depression. All those things are what we do at our pathway area when it comes to entry assessment and referral. So that's my little plug in terms of what we do in our initial pathway to CSB treatment services. And with that, Suzette, I'll pass it over to you.
Thank you. And I put Brian's contact information in the chat. I also want to say this is like a taste and see for you all, for you to reach out to the presenters to get additional information. But all of the information will be sent to you, after the meeting tonight. It'll be sent to you next, the end of this week. So thank you, Brian. Next, we will hear from Daniel Cornell. Daniel is one of the assistant directors for support coordination for individuals with developmental disabilities.
Thank you so much for the introduction. Good evening, everyone, and I'm grateful for the opportunity to be here to talk about the people that we work with and to focus the conversation on ways that you can help. I want to start by just talking a little bit about who we serve and what some of the challenges people with developmental disabilities face. We provide a training, if you're ever interested, called Understanding Developmental Disabilities, that is really just about understanding someone with a developmental disability and being understood. And I say at that training that first and foremost, people with developmental disabilities are people first. They have the same hopes, they have the same dreams, they have the same wishes, they have the same aspirations as you and I. They have the same faults and foibles as you and I. They want the exact same things out of life that we want. They want to belong. They want to feel like they're part of something. They want to work. They want they want to be included. They want to be left alone. All of the things that we want for ourselves, the people that we work with want for themselves. The challenge for people with developmental disabilities is that because of the nature of their disability, they are more reliant on the help for outsiders than we ourselves are. They are, in many ways, their success or failure towards their goals is really based on the supports that they receive, not only from their family, but from the community at large. It's important to understand that with developmental disabilities, there is no treatment. There is no cure for developmental disabilities. They are lifelong conditions that will affect the individual and the family for the entirety of their life. It is quite probable that the 12-year-old that we work with today is going to need many of the same types of supports when she turns 40 and when she turns 70. That continuity is important with support coordination. And so the underlying work that we do, because there's no treatment for developmental disabilities, because there's no cure, we're always talking about services and supports. That's what we can provide. That's why we are called support coordinators. No two words more accurately describe the role that we play in guiding and helping individuals and the families that we work with. It is my personal and professional experience that no family, no matter how perfect, can meet all of the needs of an individual with a developmental disability without outside support. One of the things that's also important to understand about people with developmental disabilities is that it is a universal thing. Developmental disabilities knows no creed, no race, no economic status, no political status. It affects human beings equally. It is, and I looked at this just at the end of 2024. If you look at the demographics of Fairfax County and the demographics of our program, they match almost perfectly because developmental disabilities are a human condition. And so developmental disabilities affect individuals and teams. And while there's no cure and it impacts everybody different, the life experiences of everybody are very different. And the support that is available and the life experiences that go into the family and the caregivers are all very different. And all of these things affect the support that's given to the individual with developmental disabilities. So when working with a family or encountering somebody with developmental disabilities, and you will get these presentations, there's a one-pager that talks just about our program. The best thing that you can do is link them with developmental disability services, because as I said, we are lifelong, and our service, once you're eligible for our program, we really don't kick anybody else. You can leave voluntarily, but your eligibility is based on your diagnosis, and that diagnosis will carry with you for life. And we will be involved for the entirety of that person as long as they do. And that support will ebb and flow over time based on those same types of experiences that we have that cause us to need more help sometime. Transitioning from school, moving houses, the same type of things that affect us affect the individuals. And like that, individuals with developmental disabilities have a higher percentage of individuals who were affected by a co-occurring mental health disorder. Not necessarily serious mental health, but anxiety, depression. 2/3 of the people that we work with right now are receiving some form of psychotropic medication for some diagnosed mental health condition. So the same things that affect us affect people with developmental disabilities, but there is a bigger stigma attached to the people that we work with, in that one of the most common things that I've heard in my 35 years is when somebody is confronted with somebody with a problem, with a challenge for somebody with a developmental disability, I don't know what the resources are. That's the trick. There aren't really resources. You are the resource that can help that individual at any moment in time. And what we do is not rocket science. In fact, in many ways, it's much harder than rocket science because rocket science is guided by laws of physics and chemistry, and human experience is guided by no such laws. It is much trickier, but really to work with somebody with a developmental disability successfully, it takes patience. It takes creativity, it takes compassion and willingness. That is really the resource that any human needs to work successfully with developmental disabilities because everything else comes with experience. Every person with a developmental disability is different. There are parent advocates that say, if you've met one person with a developmental disability, you've met one person with a developmental disability. And how that disability affects each person is very different based on their own life experience. And so our job is to be at the center with the individual and their families and their support systems, and to develop the support system around them that will identify what does this person want? Do they want to work competitively? Right now, people with a cognitive delay. So if you look at individuals from age 18 to 65, currently about 69% of individuals are employed. For individuals with a cognitive delay or cognitive disability, that number is 21%. We are by far the most underemployed segment of population, people with developmental disabilities. The numbers are staggering. The numbers of some people with intellectual disability are up to 10 times more likely to be sexually assaulted. All of these things affect our individuals in great numbers. And the challenge is finding people in the different areas who have experience in learning how people communicate differently. 30% of people with autism have no verbal language, but just because someone can't talk doesn't mean they have nothing to say. And our job is to figure out what it is they are trying to tell us. The human condition is endlessly fascinating. It is endlessly gorgeous. It is endlessly frustrating. It is all of these things. And imagine how difficult it is for us to communicate that experience to the people around us. Now imagine that you don't have access to verbal language, but you experience the same things. How do then you communicate that beauty, that pain, that spiritualness that comes to it? So for us, a huge part of what we do is linking them with our program, because then when somebody is facing suicidality, we pull in the professionals with emergency services or our peers elsewhere in the CSB, because that is a treatment need. That is not something that we're expertise at, so we pull in those outside resources to affect that. We do work with people who have severe substance use issues. We try and work with the professionals. But again, communication is one of the things that affects the individuals that we work with the most. And our goal with all of the people that we work with is to really try and figure out what is that person experiencing and what are they trying to communicate to us. And so very often we're at meetings with the individual and multiple family members. So we are birth to death. Right now we have people as young as 1 month old or 1 year old, and we have numerous people in their 80s and 90s. And we are providing service to all of those individuals for all of the time. Once you come into our program, you're ours for as long as you stay in Fairfax County. The primary driver for us right now is the developmental disabilities waiver, and I'm not going to talk about that because I could literally go until midnight and not cover it. But if that's something that you want more information about, please don't hesitate to reach out. If you ever have questions or you want to link somebody, I can be a point of contact to link with you. But it is our goal to get individuals into our program, to assess their needs. And just to put the frame of reference, right now in our program, support coordination, we serve about 5,500 individuals. Those individuals, about 2,000 have this DD waiver. The way to think about it is the package of funding that will pay for the supports and services that individual needs. We have about 3,000 people waiting for that funding source. Now, the governor and the legislature did sign legislation that will increase the number of waiver slots coming in over the next couple of years. It will not eliminate the need, despite the governor saying that it will eliminate the wait list, despite the CSB in some cases saying it will eliminate the wait list. It will not eliminate the wait list. So people will be waiting for service. And if they don't have that, there is a lot of need out there. So I'm going to do the best to wrap up. If there are questions later, I will stay on. You can feel free to email me. But with that, thank you again for the opportunity to be here to talk about the people that we work with.
Thank you, Daniel. That was a lovely presentation. Thank you. Next, we will hear from Tammy Riddick. Tammy is a behavioral specialist for youth assessments.
And Suzette, do you want to go ahead and actually introduce myself and Johanna, because we're actually going to present together as a trio here.
So that is the lovely Anika Harris. She is the Director of Diversity, Equity, and Inclusion for the CSB. And Johanna Martinez is a supervisor with the Adult Behavioral Outpatient Program.
So thank you for that, Suzette. And we are going to present as members of the Community Services Board's equity team. So without further ado, we'll start with Tammy. And Tammy, you're on mute if you're speaking.
I am speaking. Why y'all ain't telling me? Y'all gotta let a sister know. Wow. Okay. I probably, like you yourselves, are probably overwhelmed with all that you've heard, but this is the services that we are giving you. It's a wonderful, CSB is a wonderful place to offer services to you guys. We hope that what was shared, you have learned that we care. What does that matter to you? We want you to know. We want your members to understand, and we want the community to feel like we care. We are guided by our mission to help everyone in our community to live a healthy and fulfilling life. We're building a culture of equity and belonging where care, respect, and resilience develop the possibilities of workforce and those we serve. We understand that the interfaith community collaborates with groups and individuals from different backgrounds. The interfaith community is a critical, and I'll say it one more time, critical tool for embracing and understanding diversity, especially religious diversity. It allows for the exchange of ideas, and it fosters unity despite our differences. And from there, I will hand it over to Miss Anika. Thank you.
Well, good evening again, everyone. I think you heard before, but I will reiterate that the Community Services Board takes a people-first, equity-centered approach in everything that we do. We also believe that taking care of our own workforce, in turn, allows us to properly care for our community. Some of the things that we've done and that we currently do. One, we ensure that we have culturally competent staff at the CSB who lead with humility and understanding. We have a series of learning tracks and learning opportunities where staff can gain the necessary skills to work with a diverse staff and community. We honor our multilingual staff who show up for the community every day by ensuring that individuals we serve can communicate in a language that they understand and are being heard in the process. We hold cultural celebrations and uplift various races and ethnicities that make up our diverse workforce, such as, for example, our Juneteenth celebration and upcoming events that we're having. We have an equity book club that highlights various cultural literature on a monthly basis. And we have cultural dialogue sessions and we host town halls where staff can speak freely in a safe environment and address executive leadership directly. We find opportunities to give back, which you've heard here in some of these presentations, to include one of the partnerships that the equity team did, and that was with the FCPS in doing a focus on youth and their mental health challenges. So these are just a few of the ways that we put care into action here at the Community Services Board. And I'll turn it over to Johanna.
Thank you, Anika, and good evening, everyone. So one of the public-facing opportunities that we would love to bring to your attention is our Pathway to Wellness initiative, and that's taking place on September 19th. This event is free to the community and will provide a host of resources, mindfulness activities, and wealth of knowledge around mental health and wellness to individuals who are suffering from mental illness. The event will also provide support for their families, as well as a network that can help the individuals and their families navigate through mental health challenges.
Hello.
Hi, dear.
Oh, yeah.
How are
Hi.
you doing?
I'm doing well.
Are
I'm
you ready to call it a night?
listening to a webinar.
Yep, hi there again. So we are really excited about this Pathway to Wellness initiative. And once we finalize the details, we respectfully ask that we are able to provide you with a flyer that you could share with your members in hopes that they will be in attendance. So now we will conclude this presentation with Anika.
Thank you again, Johanna and Tammy. We led with our guiding statement and we want to end with the same. We hope that you will find CSB to be a valuable resource to you and your members, a resource that prides itself on the care and respect given to our staff and to the community that we serve. So we thank you for this opportunity to present to you this evening. And now at this point, we will conclude and we will open it up for questions for any of us. So I'll give the mic back to Suzette. So again, thank you, everyone.
Okay, great. You all want to stop sharing your screen? So thank you for that presentation. That was a lot of information, a lot. Does anyone have any questions for either of the presenters or anything you need clarification on? Marina?
Hi, this is Marina from Supportive Services, Fairfax County Library. I have a question about your collaboration with police, the emergency services.
I could try to help answer some of that. Let's
Thank
see what
you.
you have for me, or us, I should say.
So I just want to learn a little bit more about the collaboration and how the services are dispatched and who can use them. So that's my question.
So let me just clarify my position. I know Suzette had the challenging task of giving literally every role of each person that spoke tonight. So I work with Entry Assessment Referral. We work closely with emergency services. Quite often, when someone's at imminent risk in the community, they utilize what's called mobile services, right? Mobile crisis services comes out, they take that information, and quite often you will see a licensed professional counselor or a licensed clinical social worker or a licensed clinical psychologists go out in the field, quite often with the officer if someone's in acute distress. If there is other specific information related to that, I can get you in touch with my colleague if you want to know more about the collaborative efforts between emergency services, in addition to how we go out in the community. And if anyone else from my team wants to jump on in, I see Dan's hands up. I'll tag in a friend.
Yeah, I can speak to it a little bit. Since 2015, the Community Services Board has been working with Fairfax County Fairfax County Police and Sheriffs, as well as the local jurisdictions, George Mason, Herndon to provide crisis intervention training. This is a training that is 40 hours of intensive crisis training, specifically around individuals with mental health challenges. However, I am one of the representatives that trains from the CSB, and I train on developmental disabilities. So it is a 40-hour class, 40 hours in the class, taught by other professionals and CSB professionals to any of the police officers. And it really is about crisis intervention. And one of the things that I tell the families that we work with is if you find yourself in a situation where you feel unsafe and it's with an individual with a developmental disability, you can ask for a CIT trained officer, crisis intervention trained officer. So if you call 911 and you have a situation and you say, I have an individual with autism who's having some difficulties, I need to have a CIT trained officer, they will dispatch one. And this training kind of really focuses on how to help people de-escalate and how to handle and divert things that might go into the legal channels. In many cases, they can bring them to Merrifield for emergency services. In some cases, mobile crisis will have a clinician there. So those are just a few of the ways that we work together, what Brian talked about. And CIT training, it's still offered. It usually is about 4 times a year right now. So those are some of the ways that we work with the police and other first responders.
Thank you so much.
I will also say, if anyone, you, Marino, anyone else on the call, if you do have a person in your home who you feel may at some point be in need of a CIT officer or has been in the past, it's always a good idea to go to your district station, introduce yourself, let them know, through your family situation. Get to know the community outreach officer there, or the commanding officer. That way, when they come to your home, they have some idea already, some background information already, so that it doesn't end up, in a way that you would not necessarily want it to end up for your loved one. So, but that was a good question. Does anyone else? Oh, and also, if you want more information, because FCPD, they do have some other specific information as it relates to that, then reach out to me and I can connect you with someone.
Okay, I will reach out. Thank you so much.
You're welcome. Any other questions about the presentation? I have a question. This is probably for the division director for entry and assessment. Might be Brian, perhaps, maybe. But if I'm a community member and my child or my adult is in crisis, I don't know what to do. They're exhibiting signs. I think, either maybe they, may be struggling with substance use or mental health, a mental health concern. What do I do? Like, I have this person here. I don't know what to do. What do I do?
So the first thing, Suzette, I would say to any person in that situation is a couple things. If you are afraid that your child is at imminent risk of hurting someone or hurting themselves, that's obviously a 911 call. Dan, you kind of mentioned the correlationship between mobile crisis and emergency services, right? But if it's a situation where the individual is in acute, I wouldn't say acute distress, but has enough symptomology in terms of anxiety, depression, substance use, and you can get that individual, that young person, bring them over to the Sharon Boulevard Center, right? We have a entry, part of my job, that's why she said division director, is entry assessment referral. We have walk-in hours that's open every single weekday, Monday through Friday. We open a little later on Friday because our team needs to connect and meet and have team meetings. So I would say 10 o'clock for Fridays. But 9 to 3, Monday through Thursday. We're based on the lower level of the Sharon Boulevard Center, which is on Willow Oaks Corporate Drive. For adults. For youth, it'll be on the 3rd floor. And what happens in that process, and actually I should let Tammy talk about it for youth, because Tammy's very involved in our youth assessment team, right? But they take pretty much a behavioral health questionnaire, right? That kind of shows and illustrates what's going on with their symptomology. And from there, we kind of do what we call triage and to kind of take and look at what the next necessary steps are for getting that person support. Tammy, you want to chime in and talk a little more because this is kind of your day-to-day work?
This is kind of, yes, this is kind of my day to day. I just really want to, first of all, if you have issues, these numbers I would want you to have if you have any questions. The first number, our main number, is 703-383-8500. That's the main number to Sharon Boulevard. You can call. We closely work with the call center, who also can assist with you to get the person get to the department that you may need to get to. So first have that. But for our direct department, our number is 703-533-5634. That's the youth department. And when your person comes in, the child, I could speak to the youth. When the child comes in, they're going to be presented, like Brian spoke about, a behavioral assessment. And in that, we really just trying to figure out why you're here. Once you get there, we're going to actually develop some rapport, some relationships to make sure that what we're gathering, we link you to the right services that you need. If you don't meet the criteria of our program, we will make sure that there's resources in the community that you are linked up with. Once you're linked up with them, if you do not hear from us within a week, or if you don't hear from our resource within a week, we'll follow up and assist you with getting linked with them. So those are the services that we offer in the youth assessment.
Wonderful job, Tammy. One thing I'll also say is that through the edict back in 2017, same day access, no one gets turned away, right? So what that means is when I say walk in, like walk in, come between 9 a.m. and 3 p.m. Because if we have a large waiting room area, lobby area, we'll at least schedule you, at least we'll check in with you, right? We'll at least do a screening. So our role is never to turn anybody away from the public. Even if it's just a brief screening and questionnaire, someone will lay eyes on that individual that needs support right away. So I just want to make that plea, because quite often, sometimes that knowledge isn't readily understood or readily known, that we will literally at least do a mental health screening and questionnaire if we're at a large capacity with folks in the lobby area. And that goes for both adult and youth. So I just want to make sure the information was for everybody's ears when we leave tonight.
Brian, there's a question in the chat.
There's a question in the chat.
I was running my
I'm gonna
mouth.
get to it, but I need to follow up. Let me follow up with this real quick.
Okay, I was just going to read to Brian because I think Brian is the good one to answer this. Can you
Sure.
speak to how our partners in local government with Prince William and Loudoun County, Stacy serves Temple Beth Torah. They serve community members from all of our local jurisdictions. Can you speak how we partner with local services to support community members who don't live in Fairfax but may attend a Fairfax facility?
Before you answer that, though, let me follow up with a question related to what you were just talking about.
Oh, sorry.
Yep. So what if at like 5 p.m. I'm concerned about my child? Do I then call emergency services?
If it's an imminent risk, yes, please.
No, if it's not an imminent risk, then I have to wait till the next day at 9 o'clock.
So you're saying if you're calling at 5 p.m. again,
yeah, like I'm home, my kid comes home from school, I'm a parent. I'm all like, because
you just need someone to talk to about the situation.
Right.
So I can also give out other numbers that can support post 5 p.m. because there's always someone to talk to, right? So I'll give some of the information out, Suzette, because I want to make sure that I send out what's necessary and what's useful, because that does happen, right? The situation may be at 7:30, 7:45, 8 o'clock in the evening, and someone just may need support, and there's always someone to talk to, right? So I'll give over the right correct information probably later this evening. I just want to make sure everyone on this call gets what's necessary in terms of reaching out. But there's always afterline numbers if someone just needs someone to talk to. The biggest thing is if your child's at imminent risk or even adult at imminent risk, to please, please, please always call emergency services, because we don't want anyone in the community taking on more than they can if it's more than just needing to talk to someone.
Okay, and I'll send that out with the rest. Thank you, Brian. Sorry, Daniel, I just wanted to follow up before you switch the topic.
Yeah, I can take the next one. I think it's about, it sounds like cross-department partnerships with other CSBs locally. So every 3 to 4 months, I meet with my regional peers, right? There's 5 core CSBs in Northern Virginia. You have us, obviously, in Fairfax as the largest. Over to the west, we have Loudoun County, right? They're over to our western region. And then we meet with Alexandria and Arlington also. And Prince William makes the 5th one. And literally, we have collaborative spaces where we talk about resources and how we help each other out. Sometimes folks walk in, this happens quite often sometimes, from other jurisdictions, right? So a Prince William person may walk into Fairfax County. We encourage those individuals really to receive help as best possible where they're closest to, right? So we don't turn people away, but we do also help support folks get to the closest place where proper services are always best. And we have collaborative conversations, right? So we see a Woodbridge address, we're going to call our peers to Prince William County and say, hey, we can do our best to help, but you literally have another community service board that's right beside you, right? And this is the services they offer. And then we do those warm handoffs. So that's one way we work closely with all the other neighboring CSBs through what I call, well, not just what I call, but their regional meetings, right? With the other core Northern Virginia community service boards. So hopefully that helps. And we do definitely share resources. We work also, we give resources in terms of working with the military population quite often, because that's a state requirement, right? Service members, veterans, and families, SNVF. So we work really diligently, closely across that path. And we're also taking, how can I say this? We're making sure we're not all doing something completely different. We do all work a little slightly different, but we try to learn from each other, right? So in terms of retention is a huge thing to make sure we keep our staffing supports where they need to be. So we figure out, okay, how can we take care of our workforce? How can we make sure morale is where it needs to be? How do we offer training, especially assessment trainings, right? So we could be conscientious, whether it be cultural learning or other different ways to make sure our assessments are evidence-based practice, and that we can actually utilize it across different CSBs. So that's one way we work with our other community service boards and other jurisdictions that are close to us.
And I would just add, for the population of folks with developmental disabilities, each of the local jurisdictions, the CSBs, do the same things that we do. So the DD waiver, which is what most people are looking for, is a state program. So all of the CSBs in Virginia will follow the same regulations and policies and procedures in terms of accessing and getting folks services and then maintaining those services. So referring them to any of their CSBs, they will have a program similar to ours that's responsible for working with the waiver and individuals.
Okay, great. Thank you.
Love the question so far, Suzette. It's been a wonderful group.
It is a wonderful group. Does anyone else have any questions or comments? No one? I will say that some of the programs that Raymond talked about, if you all get the Common Ground newsletter, which I'm assuming you do, that's how you found out about this. Those, I have a standing thing for the CSB where I put in their classes and resources, so you can always, check that as well. So no one has any additional questions? Presenters, do you all have any last words you want to say? Marina has a question, sorry.
Yeah, I have one more question. Do you provide any trainings or overviews for agency and organizations in the community? I heard the first aid, mental health first aid, but do you have any others that could be offered to agencies?
Ooh, Raymond, you want to take some of that? I've been talking a lot this evening.
No, it's fine. It's actually really good because I feel like it's the reverse, right? I'm like, this is great.
Usually he's the star. I joke
great.
with Raymond quite a bit because usually he gets most of the questions and
I love it.
follow-up.
Let me be in the room. No, but to answer your question, yes, I'm trying to. I don't know why it's not preventing me, but we have a one pager. Let me see. Marina. I can send it to Suzette to send out to the group. I don't know if you're going to send a follow-up email, but I'll send my one page so it has a list of all the trainings we do in the county. And again, with all the things I kind of went over this evening, we do the trainings. You can do it through two formats, right? We have an open enrollment process where you can go directly to our website, you can sign up, and it'll go into any area of interest that you have. And then on the flip side of that, if you have, depending on the class, a certain number of meaning people for the training, we'll come to you. We'll come out to you. And we'll do those trainings in person to, and you'll have a person. It's more intimate. We can get into specific questions to your need-based population or your department, so we can do it that way. So I'll get the information. I'll get it to. I'll just send. As a matter of fact, as soon as we wrap up, I'll send Suzette an email, and she'll get it out to you. You can review the list, and if you want to sit down and go over it, that's fine. Some of the areas, I don't know if you were in when I first started, but we do suicide prevention training, mental health first aid. We do opioid overdose training. We do Talk They Hear You, which is how to have conversations with young people about drugs and alcohol. So we do a multitude of different training. When we do some specialized things, it just depends on what it is. I always tell people it's this gray area because we are the people. So I have like a bunch of different trainings. So if you have something specific in mind, you can always contact me and I can let you know if it's something we can do. We'll do it, or we'll figure it out, or I'll get you in contact with somebody who does do it. So I won't tell you no unless it's something like, I always tell people, just don't ask me for money. I just don't. I ain't got it. Everything else, prevention wise, I help you with. You ask me for money, I can't help you. I ain't got it.
Thank you so much.
I say,
Yeah, and
see
you have a
Brian, see
great
Brian,
office. Yeah,
Oh,
thanks.
see Brian. All people on this call, if you want money, see Brian Anderson. He will take care of you. I'm
so
joking. I'm
now
joking.
my inbox is going to get quite large, and that's fine.
Mhm, mhm,
So,
mhm,
so
Malone.
a
mhm.
couple, so a couple brief thoughts to add to Raymond's point. Like we are everywhere in the community. It's a little cold now, so we may not be outside as much. But when the weather warms up, especially when we get to the months of April and definitely May, we're everywhere. We partner closely with FCPS, Fairfax County Public Schools. We work closely with Fire and Rescue. Sometimes we go out to their events. We work closely with the different community centers through NCS. Obviously, Suzette's a part of that, but they also have a ton of community centers where we're constantly walking it through those different circles. So I just want to put that plug out there because if you're having something for your place of worship, I can be your guy. Now I turn it back to you. But Raymond's quite often the most popular person in the room, right? Because we have a wonderful, talented team of other prevention specialists, right? So I know business can get quite high for us, but we welcome opportunities for partnerships. And what we don't want to do is just talk to you guys one evening, then we don't hear from anybody in these squares anymore. So to me, our relationship should be ongoing and sustainable. So those were just some of the other core takeaways I wanted folks to know as I'm representing prevention services, but also our access to care unit with entry assessment and referral. That's it
Thank
for me,
you.
Suzette.
Thank you, Brian. Thank you. Does anyone else have any questions? So I will be sending out the material from this meeting and the recording, a link to the recording, so you all can watch it again for other information or share it out to members of your congregation. Please reach out to me if there's a question that you think of, and then I can send it out to the team and they can answer the question. But they do want to partner with the community to expand the knowledge and the resources about the CSB to help. And so if we don't have any more questions, I will stop the recording. And then, sorry. And